presentation. Throughout this presentation, I'm going to refer to one person, and I'm going to call that person Mary. And I'm going to talk about her treatment in the progression. And Mary is a approximately 33, 34-year-old female, married with 2 children, and came to treatment, outpatient counseling with me 1 year after sobriety. And we started with, counseling, as, therapy, as well as, neurofeedback, biofeedback, and alpha stem, which are the 3 things that I'm going to talk about today in the recovery process. And part of the other thing that I'm going to reference is this article. It's Neurofeedback Rehabilitation Reduces Anxiety in Methamphetamine Abusers. And this was published in the ISNR, which is the International Society for Neurofeedback and Research, and one of the journals that is associated with the neurofeedback training that I've done. So I want to, just to kind of set it up, that's what I'll be doing, is talking about, Mary and her recovery from not just meth, but also numerous drugs that she used in her recovery process. Okay. And my technician assistant is Caleb.
Hello.
Caleb is here beside me to guide me through it, to make sure I don't mess up with the technology. So he's been my neurofeedback technician since 2019. We both trained under Dr. Michael Cohen. I trained in 2002, and Caleb trained under him in 2019. So some of the stuff that we have today will be based on some of the work that he's done for the many years. So as you can see, this is, my background is in family relations and child development from Oklahoma State University. I'm an LPC and an LADC. I've, work with, I work around trauma, EMDR, and do, as a part of my practice and my credentials. The learning objectives for today, there were 3 things that I wanted to talk to you about, was like understanding anxiety with substance users, how to increase knowledge of actual biofeedback treatment, and have a more understanding of alternative treatment modalities for methamphetamine abusers. So let me just start by saying that, Mary has been using drugs since she was 14, and she was introduced to meth when she was 18. And until the age of 30, I think 32 is when she got completely sober. And like I said, it was a year into her sobriety when she started her treatment. And the reason that Mary came in was because of high anxiety. She had, she was, wanted to stay sober, but was doing her 12-step support groups, but her anxiety level, and she would go into a rage and anger, and her family and her children were suffering from this. And so she couldn't seem to get, to get a handle on these, these type of feelings. So that's why looking at this article again was relevant to the therapy of the work that I did with Mary throughout the past several years. So, and addictive disorders are characterized by cognitive, behavioral, and neurological impairments, which are caused by the dysregulations in our brain structure that persist well beyond early withdrawal through the months and years of recovery. And in her case, she was 1 year into it, and was all these other feelings were starting to come out. So then again, going in, so we look at axis 1 and axis 2 disorders, and substance use has been found to have a higher incidence of co-occurring in axis 1 and 2 disorders, especially with stimulants such as meth. And anxiety, according to these researchers, is the most common comorbid axis 1 disorder in substance users. And so, again, with Mary, she felt like she wasn't dealing with depression, but it was more the anxiety and the fear of failure, and the fear of, she started dealing with her family of origin issues as she got into her sobriety, and again created more anxiety as she tried to resolve some of these issues. So anxiety in young adults doubles the risk of later substance use. Mary had been sober for like a couple of years in her early 20s, but again, that didn't last, that lasted maybe a year, and so that's why coming into therapy a year into her sobriety, she knew that was the critical time when she had relapsed before and didn't want that happening again, because now she was a wife and a mother and didn't want to repeat that pattern. So self-medication in the form of amphetamine use occurs in patients with anxiety disorder, which is a risk for, for substance use. So one of the things that one of the articles talked about, or the article I referenced, said that stressful incidents are a major cause of relapse. Neurofeedback training teaches the brain to operate in a calm, rational state, even in stressful situations. So as we move on into looking at the biofeedback and neurofeedback trainings, we want to, or modalities, we want to be able to look at that and see how those are effective and how they've been helpful in that. Okay, so we're going to, looking at biofeedback. I first learned about biofeedback in the late 80s when I worked at St. John's Hospital in Tulsa on a locked psych unit. And I remember I'm thinking, what's biofeedback? And so then it was working with a young man that had rage and anger issues. And so they didn't really talk about it very much, or they didn't explain it to us in great detail, but it was like biofeedback that helped him learn relaxation techniques. So in the late 1999, I was approached by someone that said, what is neurofeedback? And so I started researching it and realized the benefits of it and found other practitioners that were using it as a form, as neurofeedback and biofeedback. So that's how my interest in it grew. And so I've not only used it with numerous patients and clients, but also with friends and family members, mostly family members through the years. So biofeedback is a technique you can use to learn to control some of your body's functions, such as heart rate. And during biofeedback, you're connected to electrical sensors that help you receive information about your body. And this feedback helps you make subtle changes in your body, such as relaxing certain muscles to achieve the results you want, such as reducing pain. So biofeedback gives you the ability to practice new ways to control your body, improve a health condition or physical performance. So you're learning how to self-regulate. And so I don't know if any of you use biofeedback or it's a part of your practice, but again, you're learning how to self-regulate, and there are different modalities, whether it's skin temperature or muscle relaxation or heart rate variability or EEG biofeedback. You're learning how to self-regulate. I'm not putting something into you. You're learning how to do that self-regulation yourself. And so for this individual, Mary, this was a huge thing for her, is to be able to know that feeling of anxiety when it would start to overtake her. How could she practice these techniques in situations where she could maybe calm herself and not go the escalation to the point where she's raging and wanting to shut down and leave. And so again, we started that journey together. So neurofeedback, like I said, is a kind of biofeedback which teaches self-control of brain functions to subjects by measuring the brain waves and providing a feedback signal. Neurofeedback usually provides an audio and or visual or video feedback. It can be a positive or negative feedback produced for desirable or undesirable brain activities respectfully. And so it has to be the response of that feedback has to be with a quick response time. So it's an accurate reading of that, and you've got to get that response time quickly so you know that it's actually an accurate feedback. So if you miss that window, then the feedback is not going to be effective. And so with Mary, we did the audio feedback. She watched a video, and so she would get audio feedback, a sound that would say when she was in focus and calm and relaxed, and then so she was rewarded that way. It was a positive feedback loop versus a negative feedback loop. And the neurofeedback rehabilitation is a way to condition your brain's electrical system, rewarding patterns that work well and inhibiting the undesirable activities. So it's also believed to stimulate growth and alter the efficiency of your brain cells which improve your brain function and cognitive behavioral function. And again, with Mary, she started out doing 2 sessions a week. She did 40 sessions. And then at the point we reevaluated at 20 sessions, and we reevaluated her again at 40 sessions. And at the end of the 40 sessions, a lot of these other symptoms that she had presented with early on were starting to stabilize. And so we reduced her to 1 time a week for several sessions, and then eventually to 1 time every 2 weeks. And so this went on for at least 1.5 years of that progression to help her work through this. So it wasn't a quick fix, along with the therapy and along with the neurofeedback therapy and the other therapies or modalities I'm going to talk to you about. We were able to see some really positive changes in that behavior pattern and in how she thought about things and reacted to situations around her. So right now I'm going to give you a quick video explaining some of this. Give me just a minute.
Depression, restless sleep. There has been a major spike in these issues with the pandemic, and I found out some are turning to a therapy that works like a puzzle-solving gym for your brain.
We're going to play something we call Pac-Man.
It kind of looks like a video game from the future.
Moves whenever certain brainwave patterns are increasing. His brain learns to do that.
Chief of Neurotechnology Michael Cohen
He's following his own brain's pattern.
carefully places the sensors, and Aiden Pepitone's brain does the rest.
The computer can tell him when his brain is doing a good job at increasing pattern.
It's called neurofeedback.
3 sensors that are required.
Based on a person's needs, those sensors are placed over little regions of your brain
Calming and quieting the mind.
where you handle emotions, verbal memory, or impulsivity, to name a few.
Pills help deal with your symptoms, but neurofeedback is like a gym.
When the brain starts firing better in those circuits,
That's him literally watching himself change his brain.
the game rewards it.
It's kind of like, how do you raise your hand above your head? We don't really know.
2 years ago,
Too good at it.
Aiden had been forced to stop doing what he loved, working as a technical director at a church. He says he was living a shattered reality, anxious, scared to leave his room, and medication was not fixing it.
It was like a car. It was just running at high RPMs all the time without me doing anything.
Cohen's own father battled severe
But
depression.
you're not competitive.
The improvement with this led to Cohen studying and opening a practice.
When people are given that chance, it is kind of remarkable how much change, like in the case of my dad, who all have personal stories that got them into this.
The biggest blessing in my life.
Harley Strike is another practitioner with a personal journey.
There's no way in the world I could even sit and talk to you without having like my heart racing 5-6 years ago.
She says her anxiety was debilitating.
I also had quite a few panic attacks during that time where I would go to the emergency room or urgent care because I genuinely thought like this is definitely the end. And I haven't had that happen in gosh, forever.
Strike says neurofeedback can fit like a puzzle piece with other therapies. Her clients in her Denver clinic range from children diagnosed with ADHD to former athletes recovering from traumatic brain injury.
I can actually achieve everything that I want in life and I'm not being held back by some sort of weight.
And today,
Obviously doing something because later on I feel it.
Aiden too is back to doing what he loves.
I feel like God brought me here to help with that process.
Keep the middle ship firing.
Really made a crazy dramatic change in my life.
Well, some insurance plans, not all, will cover neurofeedback, and the practitioners tell me the number of sessions is different for everyone. Once the results are achieved, if they are, people often return for a tune-up every 4 months to maintain those results.
So this is Again, this is the first time I've used videos in a presentation, so my assistant here, Caleb, is keeping me straight. So I hope it worked through for everyone and worked okay. So again, I'm going to go back to Mary now. So this is what Mary does. It's like, so if you're looking at the model on the screen, the sensors are placed on the head, just like what you saw Michael Cohen do to that individual. He placed one in the middle, which is the CZ. And that's, you know, it's a 1020 international system of where you place the electrodes, the EEG electrodes. And so he placed it there. And then he had one that was for, you know, grounding one, which is on usually on the left ear. And then the other, which is on the right, or the other training modality, you know, placement. So again, that's what he started with. That's what he was doing. Those are the placements. So with Mary, that's usually where we start. We start with a general placement like that, because that's for calming. And then what we do, what happens next is that the software program will analyze the EEG recording in real time. That's what I mean by it's got to have a quick response time, because then you know if you're going to get that feedback loop. And then the next thing, like it says on number 3, the software provides that either the audio or visual feedback to the brain that reinforces that positive brain activity. And sometimes we'll do both. I'll do audio and visual, or like with Mary, I just did the audio. And then over time, point number 4, the rewards train the brain to create new habits of electrical activity. So these are looking at everybody's producing these brainwave activity, you know, the brainwaves all the time. And so what we're doing with neurofeedback is that we're trying to enhance, you know, what is the state that we need to enhance, or that we need to maybe that we need to maybe produce more of those. If you're doing frontal lobe and you've got slow wave brainwave activity, you're not going to be alert and focused. So we need to train the frontal lobe to be more to be more focused and attentive. So you're not like fidgeting or moving to try to stay alert and focused. So if you can, you know, the visual here gives you the gamma waves are, you know, for insight, you know, peak, you know, hang on a minute, let me. They are to help you with, you know, the peak for expanded consciousness. The beta waves are the ones for alertness, concentration, and cognition. But and then the alpha waves are 8 to 15 hertz, and they're for relaxation, visualization, and creativity. Theta waves are meditation, intuition, and memory, and the delta waves are, you know, detached awareness, healing, and sleep. So when they're referring to in the article that I talked about, they're referring to alpha theta training for addiction. So if the alpha theta training with addiction, you're wanting again to have a relaxed visualization, you're in a relaxed, calm state. So if you're training for focus and attention, then we're training between, you know, the 15 to 16 hertz for more alertness and cognition. So you want someone to be a calm, alert, focused. So you're training those brainwaves from like 12 to 15 to 16 hertz. You're focusing on those in your brainwave activity. There. So then the neurofeedback and addiction. So going back into the research has shown that the neurofeedback will effectively reduce the psychological symptoms and effect of substance use. And then during the neurofeedback rehabilitation, the individuals learn to change the patterns of the brain waves through conditioning. So it's an operant conditioning. So in an operant conditioning, when that brainwave, when you get that feedback, you're in that feedback loop, it's a positive, then that operant conditioning says, this is what feels good, I'm doing what I need. So you get that reward. So you train your brain. It's like the plasticity of the brain to reroute that and to become more in a calm, relaxed state. And so that reduces stress and alleviates some of the psychological abnormalities the patients who've been addicted to drugs and alcohol experience. And so one of the first things that Mary talked about, this was probably after the 15, you know, after 15 sessions, one of the things that she reported was that there was still, you know, it was not, the anxiety had decreased. It was still there, and it was still problematic in her marriage and relationship with her children. But she was starting to recognize it. So she was starting to recognize before she got into a situation and learned to use those techniques to calm herself before she actually got, you know, overly excited, and she would rage. And so she would, you know, curse and yell and name call and go lock herself in a room. And so it was very uncomfortable for her husband and her young children. Her husband was also in recovery, and he had been in recovery for, for about the same amount of time. But he would more withdraw. So his way of dealing with anxiety, he would withdraw and she would go to the other end and explode. So because she was the one that would explode, then she was the one that was the identified patient at this time to work through her feelings and emotions. Eventually, they were, 2 years into the process, he was able to join her in therapy and to work through some of how these events had affected their marriage. So then Dr. James Evan, in his book, he talks about brain entrainment. And I like Dr. Evans because one of the things that he said is that there's different types of brain entrainment. And sometimes people need different things. So it's not like one is better over the other, but there's different types of entrainment. And so you find maybe you have multiple layers of that, or you find different things, but that what's going to be effective for that person. And so it has long been clear that alcoholism is associated with poor synchrony and deficient alpha EEG brainwave activity. Alcoholics have been shown to more likely to increase the amount of alpha activity after consumption of alcohol. Taken together, these findings suggest that those with a predisposition to alcoholism have deficient alpha activity and are especially vulnerable to alcohol's capacity to produce an EEG measurable reinforcing state of increased slow wave activity. So again, basically what saying is that's why I'm talking about the brainwave activity, alpha theta training is effective with addressing that with the neurofeedback. That would be the brainwave activity that we would ideally want to enhance. And so the neurofeedback of the article about opiate addiction, it says it is seen that the intervention produced significant improvement for physical symptoms, depression, and mental health. Neurofeedback was shown to decrease the craving of use of substances and improve the general mental health and opiate dependence. And so again, it affected their improvements in positive outcome towards desire of use and the relief from withdrawal, the true cravings. And that was what Mary was afraid was going to come back, were those cravings, because like I said, a year into it, she had relapsed before, and a year into it this time, she didn't want that to happen again. And the cravings and being able to, how do you rewire that, and how do you manage stress and anxiety so that you don't go back down that same path? So again, alpha theta rehabilitation is primarily designed to increase alpha and theta waves. Increasing the frequency of those waves enhances relaxation and the effects of conscious awareness. There have been multiple studies that have had positive results examining neurofeedback rehabilitation for anxiety and substance abuse disorders. And lots of times different treatment places will use neurofeedback or have that as an adjunct that someone who is in residential treatment can choose or elect to use neurofeedback while they're also in treatment, in residential treatment. Some places offer that. And so I know when they come out of treatment, if they come back into the outpatient counseling setting, then we can continue with that same modality, that same, neurofeedback setting, the same model that they had used while they were in treatment. So we can continue to enhance that. And so the article that I'm talking about, again, with, and this is kind of referencing that article, he talks about that neurofeedback significantly reduced anxiety in the abusers at post-treatment and during 1 month follow-up. And so he used the study was, the participants were assessed for Axis 1 disorders. And this is a structured, the SCID is a structured clinical interview for the DSM-4. And then they used the Beck and anxiety inventory. So those were the two that they used. And then the data was analyzed with mixed repeated ANOVAs, independent t-tests, and chi-square. So all of the participants met DSM-5 criteria for methamphetamine use disorder. They had at least a 12-month history of meth use and had no other substance-related orders or disorders. So the people, they had, strict criteria that they met and followed this protocol that they had set up. Now, all of the participants completed those 2 surveys or those 2 instruments before, during, and after the intervention, as well as at 4-week follow-up. The neurofeedback group received 18 sessions, 2 per week for at least 30 minutes each. The control group received, standard, counseling or therapy. The neurofeedback rehab protocols were used where it was SMR or CZ, which is the, occipital, not the occipital, it's the central cortex. And that's the part where the electrodes were placed. The PZ was looking more at the parietal. So those were the 2 locations for alpha theta. So the PZ would be for the parietal and would take you into alpha theta training. So one of those we're focusing on, the SMRCZ was focusing more calm, focused attention, whereas when you took them into the PZ site, you were measuring them and training them for a calm, relaxed focus with alpha theta training that took them to more of a different level. A summary of the results showed that the group that received neurofeedback had significantly reduced anxiety in the post-treatment period. These results on reduced anxiety are consistent with other studies that the article references. Okay, now I've got another quick video to talk again about neurofeedback. So again, the next thing that not only did I do neurofeedback with Mary, as her with a lot of people, I use a combination of the neurofeedback and heart rate variability. So looking at heart rate variability, there's a program that I use that's called, it's by HeartMath, HAARTMATH, and the program that I use is called M-Wave. I use the M-Wave Pro, but they also have one that's called Inner Balance that you can use on your phone or iPad that's user-friendly that you can take with you. So again, with the heart rate variability with M-Wave, they're talking about heart focus, heart breathing, and heart feeling. So again, trying to look at those trying to get you to, again, they talk about breathe into the count of 5 and blow it out to the count of 5, and to talk about your heart focus, where your heart is located in your body, and then to do the heart breathing, to breathing into the count of 5 and slowly blowing out and to relax. And then when it talks about heart feeling, what they're talking about is a positive feeling or an interaction that you have with someone. And so again, just like earlier today, one of the clients that is in meth recovery was having a panic attack. So because I know he's we've used these tools, so he calls to do a check-in. And so we start going through the heart math, the heart feeling, focus, breathing, and feeling, and have to reset that. And so again, we do those practice and take his, he's knows how to do it, but when the panic comes in, it's like there's that fear of not being able to control it. So we go back through that again and go through that process. And so then within an hour, he calls back or sends a text back and says, okay, I'm good. I'm back in synchrony, and able then to progress, through his day. But again, it's like, it's a learning of that and how to reset that, and sometimes just those reminders. So heart rate variability is a form of the biofeedback where you're, like I just said, you're feeding back to, beat to beat heart rate data during slow breathing maneuvers. And so you create a wave of peaks and valleys that match your heart rate patterns. And so this heart pattern that occurs when your heart rate increases during inhaling decreases during exhaling. So again, you're getting that, that brainwave activity and rhythm. Okay, because when we're going through anxiety, that is spiking, and you're, it's beating fast and your heart rate, and so it's spiking. So you're trying to get the slow, steady rhythm so that you feel it in your body and you're able to relax and get more oxygen to your brain and to slow yourself down to feel better. So again, this is what it looks like on the computer. This is through right now I don't use the finger one, I use the ear only, the ear clip to measure heart rate. Originally, when I started using this one in 2003, it was called Freeze Framer. So since 2003, since I've used this, it's evolved a lot over time. And I used it a lot with young kids as well as adults. And like one of the little boys said one day, he said, I feel good. He said, I did it myself. It wasn't medicine. And he said, my body feels better. And he could recognize physically what he felt like by getting his heart rate and by being in sync and in harmony that he did it. Something didn't do it for him. And the computer gave him the feedback he needed to practice that. So when he would start to get agitated, it's like, remember what that looked like and felt like. So with time, practice with that, he was able to access that to be more successful. So during heart rate variability biofeedback, the amplitude of the heart rate, oscillates. It grows many times the amplitude at rest while the pattern becomes simple. The pattern occurs in almost everyone, and it's achievable within a fraction with persons who've never previously been exposed to this technique. Again, the effect lies in the 4 processes. There's the phase relationship between heart rate and breathing, the phase relationship between heart rate and blood pressure, and the activity and the resonance of the blood pressure in the cardiovascular system. So again, you're getting that steady breathing and relaxation to help you be able to get through that. So now I'm going to show you some of the, a video then about, oh, somebody's saying they couldn't see the video. Okay, I'm just now seeing the chats. Which videos? Did you not see any of them? Okay, just now reading the chat, so I'm not sure what's happened. So give me just a minute.
So I'll share to the YouTube video. I'll pause it. Go back here. Can everyone see this now?
Can someone respond? Can you see that's on the screen right now?
Yes, I can see.
Okay.
Okay, all right, thank you.
So that means
Do I need to
someone-
go back and show the other 2? Okay, we're going to show this one and then I'll ask you. Okay, go ahead, Caleb.
From the world-recognized authorities on emotional physiology, stress, and optimal performance, HeartMath introduces M-Wave Desktop for PC and Mac. M-Wave Desktop is an easy-to-use software program with patented heart rhythm monitor that's designed to manage and reverse the negative effects of stress, anxiety, and depression while building resilience and well-being. The M-Wave system is an innovative approach to stress relief based on learning to change the heart rhythm pattern and create physiological coherence in the body. Coherence is a term used by scientists to describe a highly efficient physiological state in which the nervous system, cardiovascular, hormonal, and immune systems are working efficiently and harmoniously. The analysis of heart rate variability or heart rhythms is recognized as a powerful, non-invasive measure that reflects heart-brain interactions and autonomic nervous system dynamics, which are particularly sensitive to changes in the emotional state. M-Wave Desktop collects pulse data through a finger or ear sensor, which plugs into your computer. The program translates the information from your heart rhythms into user-friendly graphics displayed on your computer screen. Use M-Wave Desktop for just minutes a day to transform your physiological response to stress and quickly rebalance mind, body, and emotions. Using M-Wave Desktop is easy and informative. 5 different views show your heart rhythms change as you move into a state of higher performance. A 3-color visual highlights your coherence ratio as you shift into feeling positive emotions and your coherence increases. M-Wave Desktop comes with Coherence Coach, interactive games, extensive library of information, data storage, and 4 challenging levels. Experience less stress, better health, more energy, and improved mental clarity with M-Wave Desktop for both PC and Mac. Try it today with our 30-day risk-free offer.
Okay, are we back? Okay. All right. So again, and that's just kind of as a summary of what I mean that I've liked and I use. And I really encourage people like the one that's the M-Wave that people can use on their phone or their their iPad or whatever. I really encourage people, instead of getting the desktop, that they can purchase those. It's like $150 or $200. So, and everybody in the family can use it. So that's something that everybody can use, and it's an effective tool that doesn't take that much time. So usually if you're doing maybe 10 minutes a day or randomly a couple of different times a day, depending on the situation, you learn then to reset that and you have long-term benefits. So again, the next thing is talking to you about a randomized control study that was short-term, short-term heart rate variability biofeedback, as well as other rehabilitation care for alcohol dependence, can reduce craving, anxiety, and improve cardiovascular autonomic function. Out of the 48 patients who participated, 27 of the patients completed our 1-year follow-up. And including in the analysis only patients who completed the follow-up, the rate of abstinence tended to be higher in the patients who underwent HRV biofeedback 1 year earlier compared to those who received the rehabilitation treatment only. So our follow-up study provided a first indication of possible increase in long-term abstinence after heart rate variability biofeedback for alcohol dependence in addition to rehabilitation. So with Mary, she would come in and we would do 30 minutes when she did her neurofit, we'd do 30 minutes of neurofeedback, and then we would do 10 minutes of heart rate variability. So we would end it with that as a part of what her protocol was. The other tool that I've used for years has been cranial electrotherapy stimulation, and it's called a CES device. Now, the difference with this than the other two is that it actually does something to you. There's 2 different models that I've used, a CES Ultra and an Alpha Stim, and both of those are effective, but they're both CES devices. They're just made by 2 different companies. And so what the CES Ultra does is it's an alpha stim microcurrent, and it is designed to help with, anxiety and depression and insomnia. And so the alpha stim microcurrent activates particular groups of nerve cells that are located at the brain stem. So these groups of nerve cells produce the chemicals serotonin and acetylcholine, which can affect the chemical activity of nerve cells that are both nearby and at more distant sites in the nervous system. So in fact, these cells are situated to control the activity of nerve pathways that run up to the brain and then that come down through the spinal cord. By changing this electrical and chemical activity of certain nerve cells in the brainstem, alpha stem appears to amplify activity in some of your neurological symptoms and diminish activities in others. And again, this one, so sometimes when I'm working with someone, it's not one or the other. It's like, what's a combination? And sometimes, again, this is a device that they can purchase and use at home. And so it's an effective tool that doesn't have to be done in the office, whereas neurofeedback can have home units, but neurofeedback is primarily done in an office setting. So here's a brief video then about how the CES works. How are we doing it? Okay.
Are we sharing?
It's no secret, modern life is complicated. We're constantly bombarded with noise, stress, responsibility, overstimulation, and even fear. The convenience of our world comes at a price, and for many of us, that price is our mental serenity. The constant fast pace of life means many of our brains and nervous systems are working in overdrive, in fight or flight mode, constantly bracing for the next threat. This state of continual imbalance in the brain can lead to uncomfortable symptoms over time. Symptoms like panic, anxiety, and insomnia. Insomnia often goes hand in hand with anxiety, creating a vicious cycle of stress, poor sleep, and more anxiety. Sometimes it feels impossible to break out of the cycle. Standard treatments like benzodiazepines, sleeping pills, and antidepressants come with numerous side effects and risks. But the truth is, there is something out there that really makes a difference. It's an FDA-registered, safe, natural treatment option, free of the side effects so commonly experienced with medications. And instead of just putting a Band-Aid over the symptoms, this treatment actually works to reprogram your brain, fighting the root cause of anxiety and insomnia, restoring balance to the neurotransmitters in your brain, and restoring peace and calm to your nervous system. It's called cranial electrotherapy stimulation, and it's helping thousands of people get back to life and recover from debilitating anxiety and insomnia. Cranial electrotherapy stimulation, or CES as it's called, transmits a gentle, healing electrical current through the hypothalamus of the brain. This tiny electrical current simulates the natural electrical currents generated by your brain, and it helps restore peace and tranquility to your mind and your brain's function. It's incredibly simple to use. You simply apply the gelled pads to the sides of your neck, or attach the clips to your earlobes, and then turn the device on to a comfortable setting and go about your day. The treatment is painless. You may feel a slight tingling, but you can set the level of current to your own comfort. Many patients experience relief after just a few days of treatment. The results are cumulative and compound over time, with regular treatment resulting in greater and greater effects. Studies have shown CES to be more effective than drugs for anxiety and insomnia. And the best part is, CES therapy is non-habit forming and completely free of harmful side effects. It's been tested in extensive clinical trials and is demonstrably safe and effective. The best part is, CES is an incredibly affordable one-time purchase. You buy CES once and then use it in the comfort of your own home, as little or as frequently as you need it. You can use it before bed, while relaxing, or even while working around the house or at your desk. If you're trapped in the cycle of anxiety and insomnia and feel like you need help getting your brain back to a state of calm, you're not alone. Real help is available. Anxiety and insomnia don't have to be a permanent part of your life. Join thousands of patients who have experienced profound relief through CES therapy and get your life back today. For more information, visit cesrelief.com.
So again, this the model on your screen right now just kind of looks, and this is what happens in your brain when you're connected to the CES device. So, so you're looking at, like in the very frontal lobe, you have a decreased arousal and agitation. So you have a calming effect from that. So normally, what I encourage people to do is at least 20 minutes. In some of the studies early on, when I started using the CES device, you could use it on a continuous mode, especially for addictions. If you were dealing with cravings, one of the things that they recommended that you hook up to it, not just do 20 minutes, but you could stay on it prolonged until the cravings decreased or went away. And so again, it doesn't have to be just a 20-minute. And so then you get to a maintenance. The early researcher training I did said to do it, for 30 days, every day for a minimum of 20 minutes. And then after that, you would use it 2 or 3 times a week or more as needed. So that was kind of the initial recommendation. But with addiction recovery, the idea is to continue to, use it as often as you need to, and for as long as you need to. So it doesn't have to be just for that 20 minutes, again, depending if you're dealing, depending on, the symptoms that you're having to address. For Mary, she basically, she used this only in the office. She didn't use it in her home. She used it when she came in to do the therapy. So when she did talk therapy, we would hook up to the CES device and she was able to do the talk therapy. On the sessions when she came in to do neurofeedback or the biofeedback, those were not talk therapy days. Those were just for that feedback. So the CES device was used when she was there to do the talk therapy that helped decrease her anxiety and help her stay focused to work through her feelings when we were doing those sessions. So cranial electric stimulation for cognitive brain dysfunction and chemical dependency. So this is a study of about 34-year-olds, 60 alcohol drug abuse patients. So they were administered the subscales from the waist. And after undergoing cranial electric stimulation, they tested the effectiveness of it. And what happened was, in the end, it showed that, that the CES device was a valuable adjunct to any rehabilitation program for addicted persons. And in the end, it affected the changes in the areas not addressed by other treatment modalities. And that's what I like about it. Of the 3 things that I've talked to you about today, what I like about it is that each one of those things are things that, along with the therapy, if they're doing, whether they're doing EMDR, whether they're doing, any other kind of trauma work or any other, working with their, their addiction and their anxiety, is how to help them calm that and calm their bodies to be able to address and feel those feelings to work through it. So in summary, the article said that I referenced in the beginning that neurofeedback clinicians report that more than 85% of their clients who train with neurofeedback improve their ability to focus, regulate behavior, and reduce impulsivity. It said since neurofeedback helps a person manage emotions and mood and improve sleep, adding neurofeedback to an addiction treatment program gives people the necessary tools to help them be more in control and achieve success and avoid relapse. So I know that, Mary is just one of many that I've used these with. I just, wanted to consistently talk about her throughout the program. But again, these are all tools that I've used since like 2003 and 4, and have been very thankful for the addition that they add to for the treatment with individuals dealing with, with addiction, whether it's with methamphetamines or anything else. So let me ask you, do I need to go back and show you the video clip from at least one of the videos earlier? Do I need to go back and do that? Can someone respond? And then I'll go back to that one of the earlier videos. Okay, just a minute, we'll go back. Okay, we'll do the neurofeedback. Here we go. Is it on the share?
It's going to be in a second.
Can everyone see it? Can you see what's on the screen now?
We got a nod, yes.
Okay, good. Okay, here we go. Okay. Now we're going to go back to the one right before this. There's one more that, yeah, it's the one with, there it is. Okay, here we go. And this is the one with Michael, that Michael Cohen did, the guy that I trained with whom I trained.
Do you know that there are natural ways to overcome ADHD, autism, and other behavioral challenges that
Blank.
Can you see it? Someone nod?
Anxiety,
Okay.
depression, restless sleep.
Thanks.
There has been a major spike in these issues with the pandemic. And I found out some are turning to a therapy that works like a puzzle-solving gym for your brain.
We're gonna play something we call Pac-Man.
it kind of looks like a video game from the future.
Moves whenever certain brainwave patterns are increasing. His brain learns to do that.
Chief of Neurotechnology Michael Cohen
He's following his own brain's pattern.
carefully places the sensors, and Aiden Pepitone's brain does the rest.
The computer can tell him when his brain is doing a good job at increasing pattern.
It's called neurofeedback.
3 sensors that are required:
Based on a person's needs, those sensors are placed over little regions of your brain
calming and quieting the mind.
where you handle emotions, verbal memory, or impulsivity, to name a few.
Pills help deal with your symptoms, but neurofeedback is like a gym.
When the brain starts firing better in those circuits,
That's him literally watching himself change his brain.
the game rewards it.
It's kind of like, how do you raise your hand above your head? We don't really know.
2 years ago,
Too good at it.
Aiden had been forced to stop doing what he loved, working as a technical director at a church. He says he was living a shattered reality, anxious, scared to leave his room, and medication was not fixing it.
It was like a car. It was just running at high RPMs all the time without me doing anything.
Cohen's own father battled severe depression.
But you're not competitive.
The improvement with this led to Cohen studying and opening a practice.
When people are given that chance, it is kind of remarkable how much change, like in the case of my dad, who all have personal stories that got them into this.
The biggest blessing in my life.
Harley Strike is another practitioner with a personal journey.
There is no way in the world I can even sit and talk to you without having like my heart racing 5-6 years ago.
She says her anxiety was debilitating.
I also had quite a few panic attacks during that time where I would go to the emergency room or urgent care because I genuinely thought like this is definitely the end. And I haven't had that happen in gosh, forever.
Strike says neurofeedback can fit like a puzzle piece with other therapies. Her clients in her Denver clinic range from children diagnosed with ADHD to former athletes recovering from traumatic brain injury.
I can actually achieve everything that I want in life and I'm not being held back by some sort of weight.
And today,
Obviously doing something because later on I feel it.
Aiden too is back to doing what he loves.
I feel like God brought me here to help with that process.
Keep the middle ship firing.
Really made a crazy dramatic change in my life.
Well, some insurance plans, not all, will cover neurofeedback, and the practitioners tell me the number of sessions is different for everyone. Once the results are achieved, if they are, people often return for a tune-up every 4 months to maintain those results.
You know, my wife's like, what'd you do? After
So I hope that that was helpful. I'm sorry for the glitch earlier and stuff, but thank you for letting me know. I appreciate that. And I appreciate the opportunity to talk with you today about the technology and about the use, how I've used it in my practice. And